Greetings, family. Welcome back to the channel. So, a quick question. Do you know a male between the age of 40 and 75 that you love or care about? Well, if the answer is yes, then you're in the right place. 1 in 8 males are diagnosed with prostate cancer, and many die due to not being detected early. Early detection of prostate cancer saves lives. And so the purpose of this channel is really to bring awareness about prostate cancer treatment, as well as to share my own personal journey with prostate cancer. One of the things, when I was diagnosed with prostate cancer, not only was it valuable to hear from my doctor, but I immediately went online because I wanted to hear personal experience from other males who was going through this journey to get a non-medical feedback on what the experience was actually like. So, in suit, I'm sharing my journey. So I ask that if this is beneficial and helpful to you, that you like and subscribe to the channel so that it may continue to grow and help other males who may be sharing, going through similar experience or challenges. So, as I mentioned in my earlier videos, that I'm currently on active surveillance. And knowing that I'm active surveillance, there's a chance that I may have to get treatment down the road. So in the last couple of weeks, I've been looking at different treatment options for prostate cancer. My last video that I posted was on radiation therapy. And so today, the topic is going to be radical prostatectomy surgery as a treatment for prostate cancer. So with that, the first thing is, what is radical prostatectomy surgery? What does it involve?
Radical prostatectomy is a surgical procedure to remove the prostate as well as some surrounding tissues and lymph nodes. The goal of the radical prostatectomy surgery by totally removing the prostate is to fully cure cancer, with the assumption that the prostate cancer is localized, and that means the cancer has not metastasized outside of the prostate or enter into any surrounding tissues. So once the prostate is removed, then the cancer thereby be fully removed as well, thereby being able to fully cure the cancer from the patient. There's 2 types of radical prostatectomy surgeries. One is considered open surgery. So with that, it's mainly just a single long skin incision where the doctor go in and remove the prostate. And then there's laparoscopic. Here's where several incisions are made. Typically 6 or 7 are inserted, and a robotic arm is used to assist with the surgery. The robotic assisted prostatectomy is the most common surgery today used to treat prostate cancer in the United States, and primarily because there are several advantages that's called out. Less blood loss during the operation, less pain after operation, a shorter hospital stay, as well as a quicker recovery, and less time needing the urinary catheter is involved with the robotic assisted prostatectomy.
So, what have I learned about surgery? Well, first of all, the surgery lasts about 2 to 4 hours. Typically after surgery, you're in the hospital for about a day, 2 days at the max. And then you're allowed to come home. When you come home, you typically have a catheter inserted. It's normally inserted and stay with you for about 7 days till you come back and have your doctor remove it. With the robotic assisted surgery, my understanding is after the catheter is removed, you're able to be up and moving around, doing non-strenuous activities. So my understanding that they don't want you to lift, typically not lift anything over 10 pounds, but other than that, you're able to drive and move around. Most folks don't go back to work unless they're on some type of light duty. And then it takes about 6 weeks before my understanding you're able to do normal activities, and after that you're able to go back to work and manage from there. But you still have some of the side effects still can linger outside of that 6 weeks, and some of the side effects we kind of discuss.
So shown are the side effects of surgery. The first category is what we call temporary. Typically, they last no more than 6 months, and sometimes much shorter, depending on the condition of the individual. And these really fall in two categories. One is sexual, related to loss of erection, and the others is urinary, either urinary frequency or leaking after the surgery. Then you have the long-term effects. The first two on dry orgasm and loss of fertility, those are universal because then that's due to the nature of the surgeries. The other ones are typically not is not guaranteed. For the majority of the folks, from my understanding, those things get back to some form of normality within a year, and some much less, like you say, even some less than 6 months, depending on the condition of the individual. But there's a chance that these could extend much longer. So I put those as just from awareness that the last two could last longer. It all depends on how you prepare for the surgery and the individual conditions.
So my initial feeling and thoughts. So when I was in the doctor's office and my urologist was giving me the different options, and he started off with radiation therapy, and I kind of shared it with in my previous video, is that I was heavily leaning toward radiation therapy, mainly because it's less invasive, and being able, the thought of, yes, there's maybe 8 weeks of treatment or so where you're going every day to get treatment, was maybe a challenge, but it was not something I felt like I couldn't do. When I thought about the surgery, my biggest concern with the surgery it was surgery. And so there's always concerns with going to a hospital, having the surgery. 2, it was removing a body part. I don't know about anyone else, but the thought of something that was put inside you to do a function is now going to be removed was not something that I was that I'm giddy on or would want to make that my primary option. And thoroughly go in is that it's because it's been removed, it's final. Once it's done, it's done. There's no going back. And I understand that radiation therapy, once you start there, it has some consequences. You can't go back as well. And the whole thought of with radiation therapy that, if you do radiation therapy, you can't go back and do surgery. And so, as I mentioned before, I'm still kind of investigating that as, okay, what are the secondary treatment options if radiation therapy doesn't work, which being grade 1 or grade 2, if I get it to grade 2, that I'm probably less likely to have kind of identified early. But for other men who may be further down the road, that question still exists. Is there other options, or what is the best option based off where you're at from a staging level? So that's my biggest thing, is that it's surgery, removing something from my body. This is not something that I want to do. Understanding the side effects between the two, to my mind, are comfortable. I mean, there's not something that any man want to go through, but in comparison to that or the alternative, dying from this, then yes, you're going to choose this. Primary one would be active surveillance, where I'm at now, to be able to stay on that if this is something that is sustainable for me. But if not, then looking at radiation therapy and surgery, all the other alternatives. Then for surgery right now, it's not something I would want to lean into because of again, what I've already shared is just the risk of having surgery and the risk of the recovery. Even though I know other people have done it and we will get through it, but if it's not something that I have to do, it's not something that right now, my initial thoughts that I would want to do. But again, I'm still investigating, and as I learn more, I share more. Again, thanks everyone for joining. I hope this has been beneficial. Again, I ask you to like and join the channel so you can get updates as I continue to post. And everyone have a blessed day.
The goal of this channel is to bring awareness to prostate cancer and prostate cancer treatment. My desire is to inspire, educate, and serve others by sharing my personal experience with prostate cancer and the knowledge I've gained along the way. Prostate cancer affects about 1 in 8 men in their lifetime. The challenge is that there aren't many symptoms, but a simple blood test can catch it early. Early detection can be life-saving. So talk with your family, friends, and loved ones about getting screened today. And if you are a man, talk to your doctor.